The new school year is starting unlike any other. You may be among the millions of parents in the Bay Area who are trying to navigate distance learning with children who are missing their friends and not quite connecting with their online classes. KTV's School Survival Guide offers local resources outside of the virtual classroom, and we're talking about what I think is one of the most important topics this morning, and that is your and your children's mental health. So let's talk about anxiety in both adults and children by welcoming Dr. Lisa. Formally, we know you as Dr. Lisa Pion-Berlin. You're the president and CEO of Parents Anonymous. Thanks for being with us.
You're welcome. I'm glad to be here this morning.
I'm glad to break this topic wide open. We had a call with our principal very recently, and she stressed the importance of the social, emotional well-being of the child. If we can pull that circle out by one, I think it's important to say mental health is very important, perhaps for some of us more important than the 3 R's of traditional education.
Well, that's the basis of our being. We're human beings, and we are run by our emotions. So even when we talk about learning and making decisions, it's the underlying emotional issues that drive our behaviors. That's basic science. But getting in touch with those and dealing with those during a time that we've never experienced before, the levels of anxiety, uncertainty, and frustration that all parents, kids, and everybody feels because of the uncertainty of COVID, it's spreading, what's going on, and the balancing act that parents have to play at home between online school, work, the demands of being a parent, and just getting through the day. All those challenges are facing us right now.
In the earlier months of the pandemic, there wasn't much talk about mental health. Now there certainly is. I know people are turning to their own mental health experts if they have that connection already established. But there's a California Parent and Youth Helpline that can help anyone who doesn't already have an expert they can rely on. Tell us how it works.
Absolutely. Anybody can call from 8 in the morning to 8 at night. We will speak to anybody in any language. They can call us, they can text us, they can email us, they can also live chat us. And that phone number is 855-427-2736, as well as going to the website caparentyouthhelpline.org. So what we said to the governor after we went to shelter in March was, we need to create a first responder system for families. And people started thinking about parents in particular. It's not that we weren't thinking about kids and what's going on, and in general, people think about mental health. But all this pressure on everyone creates another pandemic, which is the well-being. How do you balance what's going on outside of you and what's going on inside your heart? And parents really need to learn how to tune into their kids and tune into themselves, because we are human beings first as parents. So we went to the government and said, you need to support this. Nobody can be out there without emotional support. So there are trained counselors who are compassionate, who will listen to you vent, cry, whatever you need to do to hear from somebody, somebody listening to you, actually listening to you and supporting you through this journey. You might have a friend or a family member, or like you said, a professional you can reach out to. Maybe you don't have those resources. Maybe people don't understand you. Maybe you're just sitting in the corner and feeling very sad and very depressed and don't know where to turn. Pick up the phone, reach out for help. We say at Parents Anonymous, asking for help is a sign of strength. You need to keep asking to get the help you need. I just want to say we also offer online support groups. So you can go to the website, you can sign up for a group in English or Spanish. They're offered morning, middle of the day, evenings, because parents have all kinds of schedules. Their work schedules have changed because of online school and supervision of younger children. They can't just dash off to the office, even if nobody's there to take care of something. So our lives have changed dramatically, and creating that structure and that stability for everybody, and sitting down with your kids and talking about what do we need to do to make life good for us, good in the time of COVID. So what are the safety precautions? What are the routines about washing your hands? What is the routine for fun time? You know, a lot of kids said to me, oh my God, my parents think they're running school, they're running me ragged. Wait a minute, we have recess, we have breaks, and parents are trying to work their work schedules around supervising their kids, and how much online learning is going on is also an issue depending on the school district. Teachers are feeling pulled in many directions, staff are feeling pulled in many directions. Maybe smaller groups of kids need to be on the screen. The younger they are, In order to interact with them, it's the same thing. We do an online evidence-based support group for parents. They need to have a camera, they need to have some kind of internet connection so they can sign in. And we're looking to expand and serve all the children related to those parents. And we're looking for the government as well as private philanthropy to support all that, because we can't do that alone.
Doctor,
we need to see that the well-being of parents is vital for the well-being of everybody in that family. Sorry.
I'm nodding my head to everything you say. In just the seconds we have left, how do we know if we need this kind of help? We deal with stress every day. When do we know that it's over the top?
I don't think you should measure anything. I think if you feel stressed, you should pick up the phone, call, text, or chat now, because these measures are different for everybody. If you feel a pattern of behavior is different, like you're really not sleeping, or anything changes in your life, tune into how you feel. Whatever that feeling is, it doesn't have to be a big issue. Whatever it is, reach out now. So my advice is always reach out no matter what, instead of saying, well, I'll just get over it, it'll be okay, or whatever. And you can't connect the same way. You can't hug your friends. You can't see your elderly grandma. Your kids can't hug people. So many things are missing in our life. You need to take that step, asking for help now. So I wouldn't measure it, oh, it's too little, play it down, oh, it's too big, it's not. Do it now, because anything that's preventative, it's like is tons of cure ahead of time. Anything we do to reach out early, right, is really important. And don't feel, we're not about blame and shame. We believe in the resiliency. And right, during this time, parents are incredibly resilient. They are balancing things they've never done before. They are managing stuff right, they've right, never faced before. And we want to support that.
I agree. I feel like I'm living it along with, millions of my brothers and sisters in California. We've kept the number up as you've been talking, and I'm glad we've done that. Again, the number to the California Parent and Youth Helpline is on your screen, 855-427-2736. Dr. Lisa, thank you. This is one of the many resources we have available online for our viewers at ktvu.com. Many, many resources as we all tackle distance learning together. The School Survival Guide is waiting for you at ktvu.com.